As someone who has worked as a caregiver, and I know you are watching this situation unfold in our long-term care residences, as we all are, you must be appalled by the situation.
I'm disgusted. I've been posting about it a lot. I'm really sick to my stomach when I see what's happening in the residences. But I have to tell you, Laura, unfortunately, I'm not surprised because our residences have been a mess long before COVID-19 entered the scene.
So you're saying that this neglect has been embedded in the system way before this? Can you give us an example?
Yeah, I mean, every time as a clinical social worker, I'm going into residences, private and public, across Montreal on a regular basis. And there are many good ones out there, so I don't want to just make a blanket statement. But I will tell you that in many of the residences in which I enter, I'm having a very hard time finding staff. The families are telling me the staff ratios are really poor. I'm speaking with people that are, staff that are filling in for another staff. They don't know who my client is. They don't have any information about him or her. Families are telling me about the limited services somebody is getting. And I'm seeing a lot of seniors just sitting around doing a lot of nothing and not having any type of emotional or cognitive or spiritual or psychological stimulation.
We know that, I mean, you're touching on, the mental health there of seniors, and we know that is a very big issue now. The government allowing them some newfound freedoms, I guess, if you may, for those in private residences, allowed now to take a walk or even to get in their car and go to the store. But there is concern around that as well, because in residences where there is no COVID-19, we've spoken to residents who want to keep it that way. So what are your thoughts on that?
Well, I think that the mental health is something that we do have to consider. And obviously, the worst case scenario is death. And so we have to obviously balance that as well. But the mental health of seniors is super important, mental health of anybody, as a matter of fact. And I think isolating people from their friends and family is not good for people's overall mental health. And it's not even just residences, Laura, private or public. It's also the home environment. There's a lot of seniors that are living autonomously in home that are not having any contact with families either. And I think that can have a play on mental health. I think personally, it's a good idea to start introducing family caregivers to have connections with seniors, obviously, keeping social distance, wearing masks, putting all odds in their favor. But I think it's very important to start doing that.
I want to get your thoughts on some of the confusing messaging coming from the government, primarily, this notion that now if you're in your 60s, you can go back to work in a school or daycare, but yet, don't hug or kiss your grandchild. So what do you think about that?
Well, I think we're supposed to. It is very confusing. I'm confused all the time. And even the new thing that came out with, starting May 11th, caregivers can go and see their family members in a residence, but they don't mention, well, can we take them out of the residence? Can they come into our backyard and maintain social distancing and have a barbecue if everyone's wearing masks? The messages are very confusing, and allowing people to go into public places is obviously another level of risk. I'm hoping that the consistent messaging is social distancing and wearing masks, but I'm not even hearing that necessarily. And I'm involved in a lot of different Facebook groups about seniors in Montreal, and everybody is completely confused, including myself.
We all are. We have just a few seconds left, Stephanie.
Sure.
Going back to the way we treat and care for our elderly, is there a silver lining to this?
I think we have to wait and see. I hope there is. I mean, I've been advocating for seniors for a long time. A lot of my colleagues have. What I'm hoping it does is wakes up the government and the lawmakers to see that our system clearly has been broken. Seniors are a neglected part of our population. They're deserted. They're pushed aside. They're not valued. And I am just hoping that all of this illuminates everybody and some things change in terms of our healthcare system and care and support.
Stephanie Erickson, thank you so much for your time this morning.